I'm presenting a lady by the name of Sharon H. She's a 62-year-old lady who presented to me as a doctor with 18 months history of pain in her left upper quadrant. So you divide the tummy into 4 quadrants, and the left upper quadrant is up here. She had been seen by gastroenterology specialists who had basically investigated her. They'd put a tube from the top, they'd put a tube from below, so she had a gastroscopy. They'd looked inside, taken a whole lot of samples and biopsies. She'd had a tube from into a colon, and they'd looked at that. They'd done a CT scan, they'd done all manner of fancy blood tests. They said, look, we can't find any abnormality. So they made a diagnosis of chronic abdominal pain, cause unknown, and told her, sorry, there's nothing else we can do. And they sent her away. They sent her away with some painkillers, which didn't seem to help very much. And she was totally dissatisfied. And so she eventually came to see me. And when I met her, she's a very sensible lady, and she said, look, I have had for the last 18 months a constant dull ache here. And she put her hand just there. Here it is. It's just under my ribs. And what I do is I then ask, how severe is this pain? And she said, and there's an imaginary scale. So imagine in your mind, 0 is no pain, 10 is the worst imaginable pain. So in between that, where she described, she said, look, it gets as good as 3 out of 10, and when it's bad, it's 6 or 7 out of 10. And she said, it's just constant, and it's dull, and it's nagging away, and it's dragging me down. And then I asked 2 other really important questions. The first one was, is there any relationship between this pain and what happens in your tummy? In other words, when you eat, does the pain get worse? When you go to the toilet and have a bowel motion, does it get worse? When you pass urine, and when you pass wind? So all these things, the gurgly things that happen in your tummy. Was there any relationship between the pain that she felt and that stuff? And the answer was no. Interesting. So the next question I asked, which hadn't been asked by the gastroenterology specialists, is, I said, well, can you think of anything that you were doing when the pain came on 18 months ago? And she said, thought a bit, and she said, you know, what I was doing was that we had some rubbish in the garden. We'd cleaned up a whole lot of things, and there was this pile of rubbish, and we'd ordered a skip, which is a large container that is dumped there, and it was my job to pick up this rubbish, and I put it in a bin about this size, and I carried it to the skip. I had to hoist it up, and I hoisted it pressing up against my tummy to pour it over, and I did that probably 8-10 times in the day, and I think that may have been when my pain started. She never did it again, and no one had ever asked her that question. I thought, interesting. And so, when I examined her, what I found was just this really localized tender area. It was about 4 centimeters diameter, just here, just under her 12th rib on the left. And when I pressed on it, it was exquisitely tender. She said, that's the point. And I could feel that the muscle underneath was a little bit thickened, and it was tight. And she was very reactive. And I then did something which allowed me to make the diagnosis that this lady had trigger points in her tummy, and most likely coming from the external oblique muscle. And what I did was, I did this test, which is called Carnot's test. And Carnot's test is very, very simple. I pressed on her tummy, and she said, ow, yes, that's the point. I then asked her, when she was lying on her back, and I said, just start to sit up. So as she started to sit up, her tummy muscles tightened, so the abdominal wall tightened. Now, if here I am, I'm pressing on her tummy, and below the abdominal wall there are all these organs. You've got the stomach and the colon and the liver and so on. So you've got all these structures here. So as I press on there and the tummy's relaxed, I can push right in and I press on all these structures, and you say, ow, that's sore. If as you sit up, what happens is your tummy tenses. So it then stops me. If I press on there, the tummy wall is a rigid structure and I can't press on this, so it isolates my pressing from all the organs underneath. And if the pain is coming from these organs and I press, it won't press here, it won't hurt. But if the pain is coming from muscles in the tummy wall, then tensing them up and pressing on it will make it worse. So as she sat up and I said, okay, I'm going to press now, she went, oh God, that's sore, that's worse. So her Carnot's test is positive. And again, unfortunately, nobody had thought of doing this very, very simple test. What they've done is rush ahead and spend thousands of dollars on doing a lot of other tests. And so my treatment, once I found this, was, she'd had it 18 months constantly, was that I injected just a little bit of local anaesthetic, that's all, into the abdominal trigger points. And there, when you put the needle in that space, there normally are a number of small areas which are in spasm, and where the triggers this reaction, this protective response has turned on. So I searched out each of those and I puffed really 1 or 2 mils, 0.1 or 0.2 of a mil into those areas, and until she said I could press there and she said no pain. And then what I did was a myofascial release, where you put your fingers on your tummy, you sink them down and stretch everything out. So I did that after I'd done the local, because she wouldn't have let me do that beforehand. And when I saw her back 2 weeks later, she said, well, actually, the pain's gone completely. 18 months of constant pain, 1 injection, 1 little myofascial release. Her pain was gone, but it was still tender when she pressed on it. So I showed her how to do the myofascial release herself. And I said, come back if you need to. And just before I did this talk, I gave her a ring, which was 3 months later, and I said, how have you gone? She said, well, I did it for a couple of weeks, and then the pain's gone and never come back. So this is really interesting. You see, here was this poor lady who had had 18 months of constant pain, had been investigated fully, or so they thought, by gastroenterologists who had missed the diagnosis that was right there in front of them. So she had abdominal wall trigger points, and this is a picture of the particular abdominal point trigger point, which is, as you see, is the external oblique muscle, and the trigger point sits just under the rib, either on the left or on the right hand side. There's just some studies that have come through the literature. This was a very nice one in 2001 from the American Family Physician, where the reminder was given to doctors that look at the abdominal wall. It's, as they said, an overlooked source of pain. Actually, surprisingly commonly an overlooked source of pain. When I do my work in the chronic pain clinic, I see probably 15 to 20% of the cases I see are chronic abdominal pain of unknown cause, and a good proportion of those are in fact just this cause. And the second interesting study, which was done in 2005 in Canada, was where they looked at a long-term follow-up of trigger point injections for abdominal wall pain. So these people recognized, look, this is it. They did it retrospectively. They looked at 89 patients. Most of them were women. The average age was 42. When they reviewed it, they had had 4.2 tests done to exclude other illnesses. So these people had also been through the mill. They'd had lots of other tests done. And when they reviewed them, the average length of time for review was about 2 years. So they looked at them and they asked them 2 years after their treatments. And the treatments were injection into the trigger points in their tummies. 77% had partial or complete relief of pain, that was a pain which had not been able to be treated before. So this is really important. This is an important diagnosis which so many doctors miss, not only generalists, but in fact the people that look after abdominal pain for a living, the gastroenterologists. Super important. The way to diagnose it is very simple, and the treatment is really simple and safe. Thank you very much.